Hi and welcome to my YouTube channel. My name is Dr. Tolu, and in this video I'm going to be talking about 5 reasons why your stomach ulcer is not getting better. If you find this video useful, please hit the like button, hit the subscribe button, and leave a comment for me letting me know exactly what you think about this video. Alright guys, let's begin. Normally, we expect peptic ulcers to heal within weeks to months of proper treatment. So if yours has been there for maybe quite a number of months or even years, then it's possible that one of these reasons might be why it hasn't healed properly yet. So before we talk about 5 common reasons why your ulcer might not be getting better, first, I would like to clarify that this video is not only about stomach ulcer, but it's about peptic ulcer as a whole. Now, when we talk about peptic ulcer, we are talking about ulcers that may affect the stomach and also ulcers that may affect a part of the small intestine known as the duodenum. So we are talking about stomach ulcers and duodenal ulcers. Usually, they have the same cause and many times they have the same drawbacks. So guys, number 1 reason why your peptic ulcer might not be getting better is that it may be due to either a resistant form or a recurrence of H.pylori. H.pylori was only discovered in 1983, so it's a type of bacteria that we are still getting to know things about. We don't fully understand it, but one thing we do know is that most cases of peptic ulcers are due to the presence of H.pylori. The first line treatment, which is the best form of treatment available now for H.pylori infection, is what we call triple therapy. It is where we combine a medication known as a proton pump inhibitor, using it together with 2 different antibiotics. With triple therapy, in most cases, we are able to get rid of H.pylori, which in turn helps to promote healing of the ulcer. But then in some cases, the H.pylori might be resistant to treatment, or even after treating it successfully, the H.pylori might come back and then start causing another ulcer. We should also keep in mind that triple therapy, because it contains 2 antibiotics, might not work well for those who maybe in the past have misused or abused antibiotics and have therefore built some degree of antibiotic resistance. So this might be the reason why you are treating your ulcer and it's not getting better. Number 2 on my list is bad habits. Now, apart from ulcers that are caused by H.pylori, another common cause of ulcers is the misuse or abuse of ulcer-causing medications like NSAIDs, and examples of NSAIDs are ibuprofen and aspirin. So in cases where the peptic ulcer is being treated, but the individual who is affected by the ulcer is still using ulcer-causing medications like the ones I mentioned earlier, that might slow down or may even stop the complete healing of the ulcer. Other bad habits that may lead to a delay in the healing of the ulcers include habits like smoking or excessive alcohol consumption. So if you are treating ulcers, you really need to be clamping down on some of these bad habits. My 3rd reason is, do you even have peptic ulcer? Now let me tell you one thing about H.pylori or Helicobacter pylori. Even though it's very common worldwide, no doubt about it, but then H.pylori does not cause ulcer in 80% of people that are infected with the bacteria, meaning that if you see 10 people with H.pylori, only 2 of them would have peptic ulcer. So for those who may be experiencing symptoms of peptic ulcer, it might not even be peptic ulcer that you're experiencing. It may be due to a condition whose symptoms resemble peptic ulcer symptoms. It also means that even though you are testing positive for H.pylori, you may not have peptic ulcer. Because like I said, 8 out of 10 people that test positive for H.pylori do not have peptic ulcer. So if you've been treating peptic ulcer for a while, maybe because you tested positive for H.pylori, but you are not getting any better, then it's important to consider other diseases that may have peptic ulcer-like symptoms, diseases like esophageal reflux disease or even pancreatic issues. Number 4 on my list are giant ulcers. Now, some peptic ulcers are bigger than others. To qualify as a giant ulcer, we are talking about stomach ulcers that are greater than 3 centimeters in diameter, or duodenal ulcers that are greater than 2 centimeters in diameter. Now, these kinds of ulcers take longer to heal, and they may even require some extra special care to heal completely. So if you've been treating ulcer maybe by yourself and it's not getting better, please work with your doctor, as it just might be a giant ulcer. Number 5 on my list of reasons why your ulcer might not be healing is that your case might be a complicated case. What I mean by this is that some cases of peptic ulcer might coexist with some other medical conditions, and this coexistence might make it more difficult for the peptic ulcer to heal completely. Let me explain. For instance, there are illnesses that may cause excessive secretion of gastric acid, and this can increase your risk of developing peptic ulcers. An example of such condition is Zollinger-Ellison syndrome that causes the production of excessive gastric acid. So in this kind of case, you might be using all the right medications, but if you do not tackle the underlying coexisting cause, then you might just find that you are treating it and it's not getting any better. Luckily, such complicated cases are rare. Alright guys, thank you for watching this video up until the end, and for those of you who are still here, I have a bonus point for you. If you are someone who has been treating peptic ulcer for a long time and you're not getting better, or maybe you know someone who fits into this category, it's important for you to work with a seasoned healthcare provider. My preference and recommendation would be that you work with a gastroenterologist. Those are medical consultants who are specialists when it comes to treating problems with the digestive system. It's likely that you will get better results working with a gastroenterologist rather than working with maybe a general doctor. It's important that you don't just keep treating and treating for years without noticing any significant improvement. Please go see your healthcare provider, preferably a gastroenterologist. Alright guys, thank you for watching to this point. Until we see you again, bye.